Imagine performing surgery without electricity, without modern anesthesia, and without advanced hospitals. Now imagine not only doing it successfully, but creating tools and techniques that will be used for over 1,000 years. This is the story of Al-Zahrawi, a Muslim scientist whose work laid the foundation of modern surgery. Al-Zahrawi, also known as Abu al-Qasim, was born around 936 AD in Al-Andalus, in present-day Spain. He lived in Cordoba, a city that was one of the most advanced centers of learning in the world. At a time when much of Europe was facing intellectual decline, Cordoba had libraries, universities, and hospitals. This was part of the Islamic Golden Age, a period where knowledge was preserved, expanded, and shared with the world. Al-Zahrawi spent nearly his entire life practicing medicine, teaching students, and treating patients. He was not just a scientist, he was a physician deeply committed to human care. He emphasized ethics, compassion, and responsibility in medical practice. He believed that a doctor must not only treat illness, but also respect the dignity and well-being of every patient. His greatest contribution was a 30-volume medical encyclopedia called Al-Tasrif. This was not just a book, it was a complete guide to medicine, covering everything from diagnosis to treatment. The final volume focused entirely on surgery, making it one of the earliest and most detailed surgical manuals in history. For over 500 years, this book was used as a standard reference in European medical schools. Al-Zahrawi introduced more than 200 surgical instruments, many of which are still used today in modern forms. He was the first to clearly illustrate surgical tools, making it easier for future doctors to learn. He introduced the use of catgut for internal stitches, a technique still used in surgery today. He developed methods to stop bleeding using cauterization. He performed complex procedures such as removing bladder stones. He made major advancements in dental surgery, including artificial teeth and orthodontic techniques. He described procedures for childbirth complications, including early forms of cesarean operations. He also warned against unnecessary surgery, showing a deep understanding of risk and patient safety. What made Al-Zahrawi truly remarkable was his method. He did not rely only on theory, he relied on observation, experimentation, and experience. He carefully documented his cases, explained mistakes, and improved techniques over time. This approach, evidence-based practice, is the same foundation used in modern medicine today. After his works were translated into Latin, they spread across Europe and influenced generations of surgeons. His teachings shaped medical education in universities for centuries. Today, Al-Zahrawi is recognized as one of the greatest surgeons in history, often called the father of modern surgery. His legacy lives on in every operating room, in every surgical instrument, and in every life saved through modern medicine. Al-Zahrawi's story is a powerful reminder that knowledge, when combined with compassion and dedication, can change the course of human history. More than 1,000 years later, his impact is still saving lives. Before modern medicine, there was Al-Zahrawi.